The topic for today is diabetes and pregnancy. Gestational diabetes is defined as any degree of glucose intolerance with onset or first recognition during pregnancy. Glucose intolerance means your body cannot handle the quantity of glucose in your blood, so glucose is everywhere. Now, glucose is very important for cells to function and the entire human body, but once it's in excess, the cells are unable to function. And insulin, which is a hormone produced by the body, is what does the magic of lowering the sugar levels. Therefore, anything that alters insulin production is a problem, and anything that antagonizes the effect of insulin when produced is also a problem. What happens in pregnancy is more of antagonizing the effect of insulin. I will explain this shortly, just follow me. Gestational diabetes mellitus is a severe and neglected threat to maternal and child health. Some mothers have little knowledge on this issue, and the incidence is increasing, so I thought it's useful to put some valuable information in one piece to help us. This condition can either be diabetes mellitus in pregnancy or gestational diabetes mellitus. The difference between these two is that for diabetes mellitus in pregnancy, which accounts for 8% of the cases of pregnant mothers with glucose intolerance, the patient has diabetes before pregnancy, while the second one, gestational diabetes mellitus, which accounts for 90% of cases, is caused by the pregnancy and it normalizes after childbirth. The hallmark of gestational diabetes is insulin resistance. Human placental lactogen, chorionic somatomammotropins, and other steroid hormones synthesized by the placenta during pregnancy, they antagonize the function of insulin. So as pregnancy advances, the concentration of these hormones increase in the blood, and they counter the action of insulin. So the body under pregnancy state increases its insulin production to balance out this effect. But in GDM, the body is not able to meet with this increased insulin production. The balance is not attained, and blood glucose level shoots up. Meanwhile, this high glucose concentration crosses the placenta and affects the baby in various ways. Baby gets much more than it requires. The surging maternal and fetal glucose levels are accompanied by episodic fetal hyperinsulinemia, that is excess insulin in the blood. This is to help metabolize the excess glucose. And then this excess insulin will go on to promote excess nutrient storage, resulting in macrosomia, big baby. So excess glucose, excess insulin, excess weight. It does not stop there. This baby also suffers reduction in oxygen supply because it tends to consume oxygen at a higher rate, trying to do all this work of handling excess glucose. The fetus is modeled to ensure its survival. So it's to develop escape strategies from the relative oxygen reduction by increasing red blood cell production, polycythemia, that's excess blood will result, and then this will lead to excess breakdown of red blood cells. It will now cause excess bilirubin in the blood. There's cardiac remodeling, hypertrophy, the list is endless. Now the baby is born so fast, it's not healthy. Complications like jaundice, immaturity, hypoglycemia, and so on are detected. Know that there is a healthy weight for a newborn. Some mothers compete on whose baby weight is highest, not knowing that there are abnormal weights and they have their consequences. Subsequently, our healthcare will be on child health, and that topic will be dealt with appropriately. And again, most fetuses of diabetic mother experience this growth acceleration. I want you to know that growth restriction is also seen, but is in pregnant mothers with pre-existing type 1 diabetes. Now, this information is not to scare you mothers. Knowledge brings liberation. I believe strongly that if you know the right thing, you do the right thing, because with clarity and right decision, things fall in line. So please, be encouraged and follow your skilled birth attendants keenly. Be committed and you will surely get the best achievable outcome. Please, don't be scared. Risk factors for gestational diabetes can be modifiable and non-modifiable. Modifiable ones are obesity, decreased physical activity, increased maternal age. If you want to have babies, don't intentionally delay the process. Start early, then smoking. Non-modifiable factors are first-degree relatives with diabetes, like your parents or siblings. You can't change that, right? It's non-modifiable. The prior history of GDM, delivery of a baby that weighed more than 9 pounds or more than 4 kilograms, certain ethnicity like African Americans, Asian Americans, then history of repeated miscarriages or spontaneous baby loss. Now, GDM is classically asymptomatic, but the following can be seen. Frequent fetal wastages like miscarriages, intrauterine fetal death, polyhydramnios, too much water in the uterus, then frequent urinary tract infections, candidiasis, excess weight gain, frequent tiredness. Note that these features can also be caused by other things during pregnancy. Now, for the diagnosis of GDM, the recommendation is that all pregnant mothers are screened for diabetes at booking for antenatal care. Some mothers are at higher risk because of the presence of some risk factors, so they may be subjected to some further testing to ensure early diagnosis and prompt monitoring. Tests that are usually done will include fasting plasma glucose, random plasma glucose, oral glucose tolerance test, glycated hemoglobin. Once the diagnosis of diabetes is made in a pregnant woman, continuous testing and for glycemic control is started and continued throughout pregnancy. The management of diabetes is a multidisciplinary approach. It will include the obstetrician, endocrinologist, neonatologist, dietitian, a trained diabetes nurse. The principle of underlying management is to achieve good glycemic control during preconception, pregnancy, and labor. Who remembers preconception care? Flying enhances performance. Very good. Please take a look at the health talk video on preconception care on my channel, Juliana Ome. Now, the preconception care for a diabetic mother will include counseling, attaining normal blood glucose level before conception, managing any existing complications like nephropathy, retinopathy, then contraception counseling to ensure that pregnancy is achieved at an optimum state. Then, of course, establishing rapport with your medical team and your partners. Please, if you don't go for preconception care, do not feel bad or guilt trip yourself. Begin where you are. Early booking for antenatal care is advised. The key thing your doctor starts with after proper diagnosis is to determine whether your state can be monitored with diet or you would require insulin. For your diet, maintain a healthy eating habit, spread your calories properly, and balance the nutrients in your food per serving. You need all the nutrients for yourself and for developing features. Each time you sit down to eat, make sure your food is not naked. Yeah, dress your food with vegetables, yeah, lots of them. Replicate the colors of rainbow on your plate and avoid sweets, candies, fizzy drinks. Take natural fruits instead. Make them into juices if you must consume them in drinkable forms. No additives, please. Do not eat for two. I repeat, do not eat for two. This is one area most pregnant mothers make mistakes. Just eat your normal ration. Don't overeat because you're pregnant and you want to cover for two. Irrespective of your status, whether diabetic or not, just eat a normal ration. Then avoid herbal concoctions, which the vendors will tell you that to crash your sugar level. You may be endangering your kidneys and other vital organs, as well as that of your babies. Please, mothers, be courteous. I always beg you because I know it's not easy. Some of these things are easier said. I really respect and commend mothers. You guys are special. Please try and adhere. Regular exercise lowers blood sugar and reduces requirements for insulin. Pregnancy is no excuse to confine oneself to perpetual inactivity. Be active and be intentional about it. Park your car some distance from your doctor's office and give yourself a good walking distance. Same thing when you go to the office. Walk around. Find reasons to walk around intermittently. It is very helpful. For the recommendation on what exercises to do, get the services of the hospital physiotherapist where you attend your antenatal care. Some hospitals will incorporate physiotherapy session into the antenatal care routine. Please, mothers, this is not the time to go buy food and see your friends or chat on social media. Get involved and make the best out of your routine antenatal care. Recall what you said in health talk video on antenatal care, right? Thank you. Moderate exercises such as a brisk walk 20-30 minutes after a meal is helpful. Strenuous exercises is not advisable. I don't expect anybody to go and start building biceps during pregnancy. Nah. During antenatal care, you're placed on strict monitoring as well as fetal surveillance. Delivery is at term if diabetes is well controlled and there are no complications. Meanwhile, earlier delivery may be advocated for if there are complications. Vaginal delivery is done except there are medications for cesarean section. A neonatologist, a doctor that specializes in the care of a baby within the first 28 days of life, is present at the delivery. The babies are preferably kept under strict supervision in a newborn intensive care unit. Care and monitoring continues during preperium, the period of 6 weeks or 42 days after delivery. During this period, the doctor may prescribe certain antibiotics and other medications. Do well to adhere. Do not be distracted by the fear of that adorable life in your world. Judiciously go for your health care, during preperium. Exclusive breastfeeding is the best for all babies. Ensure good hygiene. Glucose test is repeated at 6 weeks after delivery, and if it's abnormal, you'll be referred to the diabetic clinic for proper management. Please do not be discouraged. Remember that approximately half of the women with history of GDM, they go on to develop type 2 diabetes within 5 to 10 years after delivery. Then preconception care for your next pregnancy is very important. Your baby needs special care and is best managed by the pediatrician. Hypoglycemia is the problem in the first few hours, and feeding should be started as soon as possible, preferably breast milk. There are many complications of GDM, like I've mentioned earlier. Effect on the mother, effect of diabetes on the pregnancy, or the pregnancy on diabetes, or effect on the baby. Things like stillbirth, prematurity, malformations. And that being said, I want to make an emphasis here, mothers. Once you start feeling that your baby's movement has reduced, or you are not sure if baby is moving, run to the hospital and get checked, please. Then for the prevention, in mothers who are diabetic, preconception care is very important. During this period, a normal glucose level is achieved. And for those with high risk, you'll be in optimal state of health before pregnancy. So make sure to see your doctor. Then you're giving preconception folates. This is very important to help protect your baby from neonatal defects and cardiac anomalies. Then healthy lifestyle as a young woman. Eat right, young girl. You are what you eat. Eat right, drink right, exercise right, and live right. The information provided here is just a bit of all there is now about diabetes and pregnancy. Do well to learn more. Apply the tiny crumbs I've dropped here, and remember, if you know better, you surely do better. And every mother has the right to life while giving life to another. Thank you very much for being so patient. Stay till the end, and see you again. Share this with everybody. Thank you.